Good afternoon, ladies and gentlemen. Thank you so much, Weza, for the lovely introduction. As Weza has already mentioned, I am from Guardian Health, and we're all about making health more accessible. So some of the problems that we realized that pushed us to start Guardian Health were the research that we actually did around appointments and missed appointments in general. The statistics actually state that 46.2% of appointments that have been booked actually get missed. A lot of people do not attend their appointments, which is obviously a problem because it affects the well-being of the patients. Some of the reasons that we found from research that patients actually use for missing appointments range from financial issues, from transportation issues, from work, and forgetting, which forms quite a large number of the missed appointments. This is obviously a problem as it affects not only the health professionals that we're supposed to be consulted with, but it also affects the well-being of patients. Please meet Nandi. Nandi is a 26-year-old young professional. She suffers from diabetes and eczema. She falls under the statistics that I've spoken above. She constantly misses her appointments, and as somebody who suffers from a chronic illness, this is quite a big thing. She needs to be able to consult regularly, however, she is unable to due to the lifestyle that she leads. Last year, Nandi suffered from eczema, which caused a lot of issues for her. Since she missed her appointments, it resulted in her suffering for the whole year. The challenges that were faced by Nandi that resulted in her missing her appointments were that she missed her appointments due to time constraints and thinking that she would get better on her own. Her illness got worse for a prolonged period of time. She didn't have a health record that she could go with to her dermatologist when she finally was able to go. She had a prolonged diagnosis because she didn't have any medical history that she could present, and there was no remote monitoring and offline capturing to assist her to know when she actually needs to go and see a dermatologist or a doctor whenever her illnesses got worse. So we came up with the Guardian Health ecosystem. What does the Guardian Health ecosystem do? The Guardian Health ecosystem is a patient-centric approach that connects health professionals to their patients whenever the need arises. The Guardian Health ecosystem comprises of bookings and appointment reminders, so people are able to book after-hours appointments, virtual appointments, and in-person appointments. People are able to have telehealth appointments conducted via the platform and improved health delivery via the virtual consultations. We have digital health records and digital prescriptions that are owned by the patient, which means that when a patient goes and visits any health professional, they're able to go with their health record and understand exactly what is going on with their body and their health. We have remote monitoring and educational articles. Our remote monitoring allows for patients to be able to get monitored and to be able to monitor themselves from home by knowing when their high blood pressure is not within range, when their oxygen levels are not within range, and basically when a lot of vitals that they're recording are not within the normal range in order for them to seek assistance on time. They're able to upload images of their skin, of their offline records in order to show their dermatologists or their health professionals whenever they need assistance. We have a front desk and an organizational portal for organizations to be able to assist their employees with primary health care concerns and also mental health support. And we also have analytics that assist health professionals and organizations with strategic planning. Now, due to this platform that we built, Nandi's roadmap actually changed from what it was, where she needed to go physically to a health professional, where she could postpone going to a health professional until her health has gotten worse, and this is now her current roadmap. Her current roadmap is that she's able to book appointments that can be conducted anytime, anyway. She has a digital record that she owns, which she's able to show to her dermatologist. The third thing is that she's able to get quicker diagnosis that has lessened her suffering, saved her time and a lot of money because she doesn't have to go to 10 appointments before she gets a diagnosis. She can consult virtually when time is a constraint, from home, after hours, from wherever she is. She's able to use the remote monitoring to show her dermatologist how her health has been going. So her dermatologist is able to advise on whether or not she needs to go into the practice or if she can just stay at home and keep on using her medication. But most importantly, Nandi is empowered with her health, which allows her to make better decisions regarding her health. She's able to know what to eat. She's able to know how to take care of her health in order to stay healthier so that she actually doesn't have to keep going to doctors and dermatologists. So we exist for all the Nandis. What is our value proposition? Our value proposition is we want to allow you to have insights about your health. We want to enable you to own your health record, which allows for better decision making. We want to save you time and money. You can save your time and money through better appointment systems and shorter diagnosis periods. We want to enable organizations to support their employees. We want to allow you to never miss an appointment ever again. We want to support mental health because a lot of people are struggling with mental health and there's a lot of stigmas around it. We want you to use our platform securely to be able to get the assistance that you need. We want to enable access so that people can be able to consult from wherever they are. But most importantly, we are health activists. We want to empower everyone to be able to know and be part of their health journey. In conclusion, at Guardian Health, we are the Nandis. I am the Nandi who has suffered from eczema, which was so difficult to diagnose and treat until I decided that I wanted to do something about it and start Guardian Health. This was founded based on need through hackathons. We face these issues at Guardian Health every day, and that is why we started this, so that we do not have to suffer anymore and we can empower everybody else who might not have access to be able to build platforms. We want to build platforms for those people. With our ecosystem, we can be able to make a difference and empower all the Nandis, making for a healthier nation and a continent. Our team comprises of myself, CEO and co-founder. I'm a data scientist by profession, and it also comprises of Tino, who's the COO and co-founder, who's a data engineer by profession. We have Dr. Slepe, who's our health consultant, and we have Brett, who is our product and business mentor. Thank you, ladies and gentlemen, for allowing me to share the Guardian Health story with you. It's really fantastic to be part of the launch of this amazing facility. Huawei is really showing the way forward towards connecting our continent.